These days, a lot of people are sick, and there's no pleasure in saying that we recognize that this was anticipated and potentially could have been mitigated. But we are where we are. And as you go into the Christmas period, you need to be quite reflective in the sense that many, not many, some of the people that you come across may not be there the Christmas afterwards. Now, that may sound uh, a little bit like scaremongering, but I'm not putting it across like that. I'm highlighting that the presentation of disease at the moment is so unusual. The speed at which people deteriorate and pass away is incredible. And I'm saying this from observing it. So this is not just an idea. You just don't know about it as yet. And the challenge that we have is it is so difficult to predict how and who will be involved or will be affected. I've learned that many people are literally switched off these days around COVID and viral infections and so on. And I understand that. There is a lot of fatigue. The problem is we are dealing with disease presentation that is very different to what happened early in the pandemic. My best analogy at the moment, and it's not a perfect analogy, is that of chickenpox. On your first exposure to chickenpox, you get the rash and it's easily recognizable. If you have a reactivation of the same virus, that's the important, the varicella zoster virus. If there is a reactivation of this virus, you get shingles, a completely different disease presentation by the same virus. Now, that's really what we're dealing with at the moment. And so, what we're seeing is a different presentation, a different mechanism as to what is happening with people. All they know is they don't feel right. They know that something is wrong. And what's very difficult is that usual blood tests don't show anything. Maybe a little bit of inflammation, but nothing out of the ordinary. And it is that very unusual pattern that I've been researching now for a number of years. And even with the research, it is very difficult to identify and to make sense of. What I've tended to do now is take what I call a retrospective history. That means that when someone has a significant event, I then go searching for a viral prodrome. And I've done this for years. So, this is part of the reason why I recognize this pattern. And very often, sometimes days, a week before a significant medical event, you will find evidence of a prodrome. Now, it's important to note that this has always happened, meaning that any viral infection can be a trigger for medical complications. But with regards to COVID, this is on a completely different scale because one, the symptoms are so subtle that most people don't even realize that there's a viral infection. I usually have to prod it out of them. It's questions like, did you feel different? Were you very fatigued? Did you have a sore throat or a cough? And once you hear those kinds of very subtle patterns, and patients usually know when it's a viral infection, they just don't necessarily have a stuffy nose. They just have that feeling that they're unwell. I'm realizing that this should not be discounted. And this is part of the reason why, as we come into the Christmas period, and you are shifting into high exposure environments, whether or not it's the Christmas parties, whether or not it's the big family gatherings, you have got to protect your immune system. And I think that as you meet people and you talk to them and you realize that so many people are struggling, and you'd have seen that they've all been to their doctor and they've, been given some kind of medication for something else, but it hasn't made them feel better. This sequence is not something that I think should be ignored. But the sad truth is that I can't yet tell them what they can say to their doctor that would make any sense. And that's the challenge at the moment. So the biggest issue is in this period of time, one, be reflective about the people you come in contact with. Doesn't matter if you have an issue with them in the past, as you know, in families and with friends. You just never know what will happen in the year ahead. And so please be conscious about the fact that it's likely more and more people will have illnesses. And believe me, when they get sick, they can get sick very quickly. Two, be careful, as I said, with protecting your immunity. You have got to try and prevent this virus from breaking through your mucosal immunity. This is a strategy that you have to do. Make sure you rest. Don't take too much alcohol. Eat in moderation. Definitely hum. If you don't know what I'm talking about, look in the description and get the free ebook, which will give you some insights into protecting your upper airway with nitric oxide. Whatever you do, we have all got to try our best to minimize infection risk. And two, even if you get infection, minimizing the exposure period for the virus to be in your systemic circulation. That means you want to get better as quickly as you can. Simple things like the immunity to help support it, vitamin C, zinc, vitamin D, things like that, all help to try and protect you. Not easy, and I can only advise everyone as we move into this period, Christmas and New Year, take care of yourself and remember to take care of the others around you. Give them general advice. Don't criticize them. And recognize when people are struggling. Listen and see whether or not you can find ways to support them. Have a great evening, and I'm sure I'll talk to you again before Christmas.